The clerk has received a ministerial report from the Minister for Prevention of Domestic Violence. The report has been circulated by the Office of the Clerk pursuant to Sessional Order 5. I call on the Minister.
Thank you, Madam Speaker. Madam Speaker, I stand here today to provide a report on domestic and family violence in the Northern Territory. While domestic and family violence is not a territory-specific issue, with domestic violence rates 3 times higher than the national average, it is without question an issue that impacts the Northern Territory more greatly than any other jurisdiction in Australia. More than 1/3 of offenders are before the courts for a domestic violence-related offence. The domestic family violence assault rate is increasing. In the past 8 years, reported domestic family violence assaults have risen across the Territory by 82%. In some regional areas, domestic violence assaults have more than doubled. Tennant Creek, 101%. Katherine, 135%. Palmerston, 180%. The Northern Territory domestic violence homicide rate is 7 times the national rate. Since 2000, 87 women have lost their lives to domestic violence in the Northern Territory. 93% of them were Aboriginal. Since June this year, 9 more have lost their lives in incidents of alleged domestic violence homicides. The financial cost of domestic family and sexual violence to our community is more than $606 million per annum. Domestic family and sexual violence is the main driver of homelessness in the Northern Territory. More often than not, it is the trigger that results in a child being placed into care. Yesterday, the Northern Territory coroner, Elisabeth Armitage, delivered her findings following the inquest into the domestic family and sexual violence-related deaths of 4 Territory women. 4 vibrant Aboriginal women who were daughters, sisters, aunties, mums, grandmas. The coroner declared the situation a terrible, terrible carnage. In 2016, the then Northern Territory coroner, Greg Kavanagh, when handing down his findings of an inquest into the death of 2 Aboriginal women in Alice Springs, said, "In the Aboriginal communities of the Northern Territory, domestic violence, is literally out of control." A revisiting of his recommendations at that time find them eerily similar to those made by Coroner Armitage yesterday. The circumstances of his handing down those findings are similarly familiar. Domestic family and sexual violence is insidious and impacts thousands of Territorians directly and indirectly. Each and every day, perpetrators terrorise their victims, who most often are known to them. It tears families apart. Domestic violence does not discriminate. It does not respect or fear race, gender, sexual orientation, or religion. It is driven by gender inequality. At heart, it is about power and control. External factors such as lived experience of violence, drug or alcohol abuse, mental health issues may be contributing factors, but they are not excuses. It can take the form of physical, sexual, emotional, social, verbal, spiritual, economic abuse. For victims, it is relentless, and as we are seeing all too frequently in the Territory, it is too often a death sentence. The true tragedy, however, is this is not some new reality we have stumbled into in the last few months. The heartbreaking reality is that domestic violence has become so entrenched in our community we are becoming numb to its impact. For our regional and remote communities, the increase in domestic violence is so significant. It is a day-to-day battle for survival for our most vulnerable. The only real change we have seen in past decades is that it is no longer a topic in our community shies away from, but it remains one that our community seems at a loss as to how it can be resolved. After the coronial findings were handed down in 2016, the then Gunner Labor government took the view that the solution was the creation of the NT's Domestic Family and Sexual Violence Reduction Framework. Launched in 2018, the seemingly comprehensive framework spanned a decade, from 2018 to 2028 and articulated a vision to make sure Territorians were safe, respected and free from violence wherever they chose to live, work and play. The desired outcomes were listed as domestic, family and sexual violence is prevented and not tolerated. Territorians at risk of experiencing violence are identified early and provided with effective interventions. People experiencing domestic, family and sexual violence are protected and helped to recover and thrive. Perpetrators are held accountable and connected early to responses that change their behaviours and reduce violence. Legislation, policy and funding model enable a responsive, high quality and accountable domestic, family and sexual violence service system. A panacea that would reduce all forms of domestic, family and sexual violence, creating a future environment where women and children were safe and families supported. Broken down into 3 action plans. Action Plan 1, changing attitudes, intervening earlier and responding better, 2018 to 2021. Action Plan 2, 2022 to 2025, taking stock, evaluate and review, building on what works. Action Plan 3, 2026 to 2028, sustaining effort and measuring change and success. Damningly, however, at the time Action Plan 2 was put forward, it was noted that at the time no formal evaluations have been completed of the domestic, family, sexual violence framework as a whole, although an evaluation of Action Plan 1 is underway. A new focus on monitoring, evaluating, accountability is a priority in the implementation of Action Plan 2. Whilst it would have seemed common sense that a focus on monitoring and evaluating the framework would have been a cornerstone of the framework from day one, even after acknowledging that this was lacking in the initial phase of the framework's implementation, the outputs and their indicators largely remained aspirational. In developing Action Plan 2, it was concerningly noted that it is not feasible, cost-effective or appropriate to formally evaluate all aspects of the domestic, family, sexual violence framework, with a small concession, but review is required, particularly of its key components. Having arrived at that conclusion at that juncture, it would have been prudent to take a step back and consider how the framework could possibly achieve its goals to reduce all forms of domestic, family and sexual violence, creating a future environment where women and children were safe and families supported, given it was acknowledged the framework likely was not able to be evaluated. On being appointed Minister for the Prevention of Domestic Violence a few short weeks ago, one of the first questions I asked was, what are we doing and how do we know it works? On learning some 6 years after the framework was launched, there was little, if anything, available by way of outcome reporting for the many programs being funded in this sector. The question then became, how can we expect the organisations we have tasked with working to achieve the outcomes outlined in the framework to succeed if we have not provided clear guidance on how those outcomes will be measured and advice on what success looks like? Is success reporting on the number of victims of domestic violence who take shelter from their violent partners, who've been offered vital periods of respite, but who ultimately find themselves doomed to return to their home with the perpetrator of the violence against them and their children still in residence? Is it reporting the number of perpetrators who've undertaken behavioural change programs, knowing that even after more than a decade of these programs being run across the Territory and Australia more widely, as was found in the Monash University Engaging in Change, a Victorian study of perpetrator program attrition and participant engagement in men's behaviour change programs, evaluating the success or otherwise of such programs is problematic, with little in the way of evidence-based research to demonstrate that behaviours have actually changed. In the absence of a methodology, given the only true measure available is the number of domestic violence assaults reported, which has almost doubled across the territory in the last decade, it was clear to me that what we are doing in this space is not working. A readjustment is needed. Our systems are not just broken, they are shattered. In taking a step back, we need to ensure there is clarity for service providers around the expectations for the programs they are delivering, guidance on service gaps that will inform the development of programs to be developed as part of our government's funding commitment to address the demands and stresses placed on our community as a result of domestic violence and family sexual violence. We need to work with communities, with our Indigenous elders and leaders who are perfectly placed to guide our younger generations to understand that domestic family and sexual violence needs to be stopped. We need to equip those tasked with keeping our community safe with the legislative framework that allows them to take action immediately, taking any and all necessary steps to protect victims from perpetrators. Each and every Territorian has a role to play in ending this cycle of violence. Our government will continue to fight for needs-based funding that recognises that our women, most especially our Aboriginal women, Madam Speaker, are the ones who are most at risk of domestic family and sexual violence in our country, and that they deserve to be supported in reaching the goals set out in the framework, safe, respected and free from violence wherever they choose to live, work and play. Madam Speaker, our government commits to working to investing in programs that are effective. The Department of the Chief Minister and Cabinet, working with the Department of Children and Families, is leading work to coordinate an investment plan for the $180 million election commitment. Areas investment will look to include workforce and sector development, education and prevention activities in schools and communities, community-led prevention activities including public awareness campaigns on safe, healthy and respectful relationships, an evidence-based approach in developing programs targeted at changing perpetrator behaviour, victim-centred responses to reduce domestic family sexual violence, early intervention with young people starting to use domestic family and sexual violence, supporting tools for police to respond to domestic family and sexual violence, including co-responder models with specialist services. We will invest in our regions. The Arnhem region, we will look to introduce programs for primary prevention and early intervention. In the Barkly region, programs to support response, recovery and healing, including crisis accommodation to address violence impacts and reduce trauma. The Big Rivers region, early intervention, response, recovery and healing and behaviour change programs. Central Australia, Greater Darwin and Top End regions, housing pathways, prevention, early intervention, specialist domestic and family violence services, including crisis accommodation. We will look to the experiences of other jurisdictions who have developed programs designed to remove perpetrators rather than victims from the home environment to minimise the disruption and trauma for victims. Most importantly, we will consult with communities and service providers on the ground to understand what is needed. I have already visited the Barkly and Central Australian regions and will travel to Big Rivers and the Top End regions before the end of the year to speak to the workers on the ground, to speak to the services who have been tasked with helping resolve the scourge of domestic family and sexual violence, to talk to the businesses to see what they feel they can contribute in addressing this most horrendous of circumstances. We will listen to frontline workers on what works and what doesn't. Much has been invested and there are many, many people willing to step up and take a stand against family and domestic violence. For the next 16 days, every day, you will hear a message and have the opportunity to learn the story of somebody who is working in this field through the 16 days of activism hosted by the United Nations, which will culminate in a community gathering on the 16th of December, giving people the opportunity to come together and discuss what we can do as a community to call out this behaviour and stop it before it continues to take more of our wonderful, amazing women from us. Funding alone, however, cannot fix this problem. At the end of the day, domestic violence is a behaviour, but behaviours can be changed. The only way for change to happen is for communities, every single one of us, to accept the role to call out those who resort to domestic violence. For our most at-risk communities, leaders in those communities must accept that they are best placed to enable change. It will not be easy, but we as a government will do all in our power to support communities to end this cycle of violence. Madam Speaker, I would move that the Assembly take note of this report.